The fact, this was written in March 5th, 2009, so a month and a half ago. Kurt Nimmo, with links to the now declassified documents, U.S. Air Force study proposed a 2009 influenza pandemic for just this time of year. So, Steve, we'll get your for that. The problem here, though, is that this is three different flus, bird, pig, human mixed, from all over the world. It always comes out of Asia.
Well, the 1918 Spanish flu virus was cultivated by cadavers when specific teams from Fort Detrick and other countries went to areas where the cadavers or the corpses would have been preserved. Now, Alex, I was the first guy, I'm only saying this to put things into perspective, to state that the reason this is being cultivated is to be integrated into a biological cocktail that would be released at a later date. Do you remember? Well, the 1918 Spanish flu virus was cultivated by cadavers when specific teams from Fort Detrick and other countries went to areas where the cadavers or the corpses would have been preserved. Now, Alex, I was the first guy, I'm only saying this to put things into perspective, to state that the reason this is being cultivated is to be integrated into a biological cocktail that would be released at a later date. Do you remember?
For that. The problem here, though, is that this is three different flus, bird, pig, human mixed, from all over the world. It always comes out of Asia. Now, the fact, this was written in March 5th, 2009, so a month and a half ago. Kurt Nimmo, with links to the now declassified documents, U.S. Air Force study proposed a 2009 influenza pandemic for just this time of year. So, Steve, we'll get your
that are available than I have in the genetically altered modification of viruses. From the time mad cow first broke out, I said, listen, this is going to be used as a bioweapon prior to it being released in Great Britain. I said, when you've got guys down in New Guinea checking out the headhunters for the disease called Kuru, I said, you can bet your bottom line somebody's developed a bioweapon. The thing that concerns me the most is the art and antiquities guy in Mexico that died 12 hours later after shaking Barack Obama's hand. The fact that we don't know, the expedient nature of his death or how long he may have been exposed prior to dying is telltale to me. Again, ladies and gentlemen, 10 years ago, I wrote the book Breathe No Evil. And Alex, given the 96 report, given what's going on, given everything that's taking place, this is the traditional shot fired across the good ship Lollipop USA, and people had better get serious. Now, here's something I think everybody's got to consider. If this is a specific race or a race-specific or a genetically marked targeted group of people, a friend of mine, Doug McIntosh, just sent me an email saying, Steve, Cinco de Mayo is coming up, and if it is the race-specific bioweapon, then remember this, Alex, all you would need is people who to gather in large groups across the country who are specifically susceptible to this form of genetically altered virus, and the rest is going to be history. And so now, Alex, this specific strain and the strain that will come thereafter, and the mutant variations in between. Imagine having tentacles on the ends of the genes that are basically able to grab any form of mutating viruses and or bacteria. This is how evil and sinister this is. And I think that people had better understand that this is not a trial run. This is the initiating run for the big run. We know this, and I got to touch on this because you need to hear this. On Saturday, when you were doing your emergency broadcast, the entire command and control for martial law goes up in an airborne command structure. They ordered.
That's the 5 doomsday planes, which they now admit were activated. They told folks Sunday morning and admitted they initiated the martial law control grid under the executive orders. Go ahead.
Absolutely. But what you don't know is that while you were on the air, the order went out to literally every single military let's say, asset that was on HF, high frequency, was told to get off. At the same time, every state's emergency communications network was activated. So when people think, Alex, that this is just a bunch of brouhaha that has no relevance, that's how serious it was. You need to understand that what was going on Saturday night was the entire command and control structure ready to go at a moment's notice. Most people don't understand is that the biological weapons now are race specific, and I want to cover this. I don't know if you've already covered this, but about a decade ago, one of the most famous bioengineer scientists was arrested in South Africa who was working on race specific gene markered bioweapons. In other words, if they want to target whites, they can target whites. They want to target blacks, they can target blacks.
And for some states, they are reporting it is really impacting the African American community the most, with black patients dying at a much higher rate than any other groups.
After data showed that this area of Northwest Baltimore, where 95% of the population is black, have the highest number of COVID-19 patients in the city.
And why that doctor says the outbreak has been hitting African Americans particularly hard. Aaron.
Well, this doctor here at Sinai Hospital has been researching social inequalities and how it impacts health since before the outbreak. Dr. Susan Mani is the years. She's collected data on social disparities in African American communities to help improve health outcomes. She says inequalities like lack of resources.
New numbers from the CDC show African Americans make up about 33% of confirmed cases of COVID-19 in the U.S. Just note, African Americans only make up about 13% of the general population. Meanwhile, 45% of
color especially hard, according to early data. The CDC has not published breakdowns of deaths by race, but some places are disclosing that, and the numbers are alarming. In Michigan, roughly 40% of deaths were among African Americans last week. In Louisiana, almost 70% of deaths were, and that was true in Chicago as well. As part of our Race Matters series, Yamiche Alcindor takes a closer look at what's happening.
Particularly bad in Chicago. That city's mayor, Lori Lightfoot, joins me now. Thanks so much for being here, Mayor Lightfoot. Mayor Lightfoot. In Chicago, some 70% of the people who have died from the coronavirus are African American, and the city's population is only 29% African American. We're seeing other trends in Michigan and Louisiana that also show that African Americans are disproportionately part of the death rates in those states. What's behind
it? It shows that African Americans with COVID-19 are dying at a higher rate than others here in Columbus. 2 of the 6 COVID-19 related deaths were African Americans.
At any time, but they are finding out that there are factors that are causing higher death rates in African American and minority communities.
For African Americans. That's coming straight from Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases. Black community COVID-19 showing unacceptable disparities for African Americans. That's coming straight from Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases. Black communities across the country are being hit especially hard by the virus, many because
are seeing a disparity around the country with our African Americans with COVID-19.
17% of coronavirus-related deaths in Columbus are African Americans, and that's lower than the national average. But Dr. Maishika Roberts says it's something she will keep watching closely. She points to the at-risk populations, people with diabetes, heart and lung disease, saying those diseases are more prevalent in the African American community.
Some of them
is affecting diverse communities economically and medically. And this morning, we're focusing on disparities, in particular in healthcare. As coronavirus cases spike in much of the country, rates of infection, hospitalizations, and deaths are higher for minorities. Black